193 emergency. What's your situation?
Please help me. My wife is having a baby. I need an ambulance now.
Sorry, sir. We don't have any ambulance in your area. You need to get yourself to the nearest hospital on your own. We are very sorry, sir.
Okay, I take her on my bike.
Good evening and welcome to the second program of the Maternal Health Channel television series. Around the world, over 500,000 women and girls die from complications related to pregnancy and childbirth each year. 99% of those deaths occur in underdeveloped countries like Ghana, where the maternal mortality rate continues at an unacceptably high level. The figures may vary widely by source, but the best estimates for Ghana suggest that between 1,500 and 4,000 women and girls die each year from pregnancy and childbirth-related complications. Additionally, another 28,000 to 120,000 may suffer from disabilities caused by such complications. This evening, we return to Keta in the Volta region of Ghana to present the second part of the story about Charity, the popular local woman who died from giving birth. What exactly happened that night when a taxi rushed a dying Charity through the gates of Keta Municipal Hospital? Parts of the story have been dramatized to share with you its unique moments, as well as the salient factors pertinent to our understanding of this tragic event. Let's take a look. The 17th of July 2012, a taxi sped down this street towards this hospital gate. Inside the taxi was Charity, a woman in her 30s who was pregnant and struggling for her life. She was bleeding profusely and almost unconscious. Her husband, Joseph Sam, was by her side, and he was in tears. The hospital was quiet, almost gone to sleep, except for the night staff and people waiting on family members on admission. The taxi's lights kept flashing and alerting Sam to the fact that each passing second was critical to saving his wife's life. A nurse rushed out with a wheelchair almost 24 hours since Charity and her husband left Nigeria. The long delay in getting here now spells real danger. She had lost a lot of blood and was barely conscious. The ordeal had taken a decisive turn. A situation Dr. Damale knows very well. He is a consultant at the Obstetrics and Gynecology Department of the Kolebu Teaching Hospital in Accra.
The commonest cause of maternal death is blood loss. Either before delivery has a complication that is leading to bleeding, or soon after delivery, the womb is not able to contract well. There are measures to resuscitate, but ultimately, what you need to replace blood is blood.
Unfortunately, Keta Municipal Hospital does not have a blood bank, leading to crucial time lost.
Before you start mobilizing blood, you are already far advanced.
Sam, Charity's husband, foresaw this challenge and managed to buy some pints of blood along the way. From where, we're not sure, but without proper storage, the blood was not good to use.
That blood is wasted, so they cannot use that blood anymore.
Couldn't Charity have been transferred to another, perhaps better equipped hospital?
It would take you over 2 hours to arrange for an ambulance from somewhere to come in and then to move the patient.
Our sister hospitals too may be full at a time. So some mothers even sometimes go from one hospital to the other. By the time they finally reach where care can be taken, they're actually quite ill. They may come in having had a convulsion. They become unconscious, their kidneys may fail, they may start bleeding, they may actually have a stroke.
She was rushed through these doors into the theater where she was operated on. It was a long and complicated operation. The doctor and supporting staff did their best, and Charity was determined to live. It appeared she had survived the surgery, but soon after midnight, she relapsed and gave up the ghost.
The big problem we have is that the delay in deciding and arriving in hospital brings our clients rather moribund when they come in. So if there will be a maternal death, it often occurs in the first 24-48 hours of their arrival.
Why are so many women dying in Ghanaian hospitals? Apart from the protracted delays in getting to the hospital, the inadequate hospital facilities and lack of space, Dr. Damale points to another essential factor.
Skilled attendance at delivery drastically reduces the maternal deaths.
But for Joseph Sam, it's all a little too late. His beloved wife is gone, and gone forever. He will never see her again.
I think I can say more than to say sorry. It's very, very painful.